Good afternoon. Today we are discussing about the topic schedule. It's in the D&C Act, and the main aim of the study is to know the drug, cosmetic and other medical devices are categorized legally based on the law. And at first, Schedule A, it is a form for application of license or issue or renewal of license. Schedule A is the form for application of license or issue or renewal of the license. And Schedule B is the rate of fee for the test or analysis by central drug laboratory or the government analyst. Rate of fee for the test or analysis by central drug laboratory or the government analyst. And then Schedule C. Schedule C is, it is a biological or special product whose import, distribution, manufacture are governed by special provision. It is the biological product whose import, manufacture, distribution are governed by special provisions. Example, sera, vaccine, antigen, insulin, etc. And Schedule C1 is the special product or non-parental administration. Special product for non-parental administration, that are drugs belong to digitalis categories or ergot and its preparation or vitamins, vaccine, adrenaline, etc. whose import, manufacture, distribution are governed by special provision. Schedule C is the biological product or parental preparation whose import, distribution, manufacture are governed by special provision. And Schedule C1 is the other special product for non-parental administration whose import, manufacture and distribution are governed by special provision. And then Schedule D. It is a list of drugs exempted from the provision of import. List of drugs exempted from the provision of import, like skimmed milk, powdered milk, etc. And Schedule E is the list of poisonous substance under Ayurveda, Siddha and Unani system of medicine. Schedule E is the list of poisonous substance under Ayurveda, Siddha, Unani system of medicine, like snake poison, mercury poison, etc. And Schedule F. In Schedule F, the part 12B is important. The part 12B, the requirement for operation and functioning of blood bank for the preparation of blood component. Schedule F, in Schedule F, 12B is the requirement for functioning, operation of blood bank and for preparation of blood component. And in Schedule F, the part 12C1 is the requirement of manufacturing of blood product. In part 12, C1 is the requirement of manufacturing of blood product. And part 12 C2 is the requirement of manufacturing of blood product from finished bulk products. Part 12 C2 is the requirement of manufacturing of blood products from bulk finished product. And part 13 is the general. Then the F are further classified into F1. F1 is the, in F1, part 1A is the provision applicable to the production of bacterial vaccine. F1, provision applicable to the production of bacterial vaccine. And part 1B is the provision applicable to the production of viral vaccine. Provision applicable to the production of viral vaccine. And in part 2, provision applicable to the production of sera from living tissue. Provision applicable to the production of sera from living animal. And part 3, provision applicable to the manufacture and standardization of diagnostic kit. Provision applicable to the manufacture and standardization of diagnostic kit. And then Schedule F2 is the standards for surgical dressing. F2 is the standards for surgical dressing. And F3 is the standard for umbilical taps. F3 standards for umbilical taps. And FF is the standard for ophthalmic preparation. Schedule FF is the standard for ophthalmic preparation. And then Schedule G. Schedule G is a substance that can be used only under medical supervision. Schedule Gs are used only under medical supervision. And then Schedule H is a list of prescription drug. Schedule H are the list of prescription drug. And Schedule H1, these are the list of third and fourth generation antibiotics. Schedule H1 is the list of third and fourth generation antibiotics. Then Schedule J. In Schedule J, the disease or ailment which a drug may not be prevent or cure. The disease or ailment which a drug may not be prevent or cure, like AIDS, cancer, blindness, etc. And Schedule K, the drug exempted from certain provision of manufacture of drug. The drug exempted from certain provision of manufacture of drug. And Schedule L is the good laboratory practice. Schedule L is the good laboratory practice. And Schedule M. Schedule M is the good manufacturing practice. And Schedule M is further classified into Part 1A, specific requirement for manufacturing of sterile product. Part 1A, specific requirement for the manufacturing of sterile product like small volume, large volume, parenterals and other sterile preparations. And Part 1B, specific requirement for the production of oral solid dosage form like a tablet, capsule, etc. And Part 1C is the specific requirement of manufacturing of oral liquids, emulsion, suspension, syrup, etc. And Part 1D is the manufacture of external, specific requirement for the manufacture of external preparation like ointment, cream, paste, etc. And Part 1E, specific requirement for the manufacturing of meter dose inhalers. And 1F is the specific requirement of premises and plan for manufacturing of bulk drug. Specific requirement of premises, plant and material for manufacture of bulk drug. Part 1 is the specific requirement for sterile dosage forms or sterile products, and Part 1B is the specific requirement for oral solids, and Part 1C specific requirement for oral liquids, and 1D specific requirement for external preparation, and 1E specific requirement for meter dose inhalers, and 1E specific requirement for plant, premises and material for bulk preparation. Then Schedule M1. Schedule M1 is the requirement of factory and premises for manufacturing of homeopathy preparation. Schedule M, requirement for the factory, premises and for the manufacturing of homeopathy preparation. And Schedule M2, requirement of factory and premises for the cosmetic preparation. And Schedule M3, requirement of factory and premises for the manufacturing of medical devices. M1 homeopathy preparation, M2 cosmetic, M3 medical devices. Then N. Schedule N, it is a list of equipment for an effective running of a pharmacy. List of equipment for an effective running of a pharmacy. And Schedule O, standards of disinfectant fluid. Schedule O is the standards for disinfection fluid. And P, it is the life period of drug. Schedule P is the life period of drug, and P1 is the package size of drug. Schedule P is the life period of drug and P1 is the package size of drug. And Q. In Q, Part 1 is the list of dyes, colors, pigment permitted in soap and cosmetic. Schedule Q, Part 1 is list of dye, colors, pigment permitted in cosmetic and soap. And Part 2, list of color permitted in soap. Then Schedule R, standard for condoms of rubber latex or other medical contraceptive. Schedule R is the standard of condoms for rubber latex and other medical contraceptive. And R1 is the standard for medical devices. And Schedule S is the standard for cosmetics. Schedule S is the standard for cosmetic. And Schedule T is the requirement of factory, premises and hygienic condition for Ayurveda and Unani system of medicine. T is the requirement, factory, premises and hygiene system for Ayurveda, Unani system of medicine. And Schedule U marketed under generic name of drug, that's only marketed under generic name like analgin, aspirin, ferrous sulfate, etc. And Schedule X is the list of narcotic and psychotropic substance. Schedule X is the list of narcotic and psychotropic substance. Let's conclude. Schedule A, it is the form for application or renewal of license, and Schedule B is the rate of fee for the test analysis by central laboratory or government analyst, and Schedule C is the biological and special product whose import, distribution, manufacture are governed by special provision, and Schedule C1 is the list of special product whose import, distribution or manufacture are governed by special provision. And Schedule D is the list of drugs that are exempted from the provision of import, and Schedule E is the list of poisonous substance under Ayurveda, Siddha, Unani system of medicine, and Schedule F is the requirement for functioning and operation of a blood bank, and Schedule F2 is the standard for surgical dressing, and F3 is the standard for umbilical taps, and Schedule FF is the standard for ophthalmic preparation, and Schedule G is the list of substance used only under medical supervision. List of substance used only under medical supervision. And Schedule H is the list of prescription drug. Then Schedule J, the disease or ailment which cannot be cured by a drug. Disease or ailment which cannot be cured by drugs, that are AIDS, cancer, etc. And Schedule K is the drug exempted from certain provision of manufacture of drug. And L is the good laboratory practice, and M, it is good manufacturing practice, and in M, part 1 is specific requirement for sterile products, and part 1B is specific requirement for oral solid, and 1C is specific requirement for oral liquids, and 1D is specific requirement for external preparations, and 1E is specific requirement for beta dose inhalers, and part 1F is specific requirement for plant and premises for bulk preparation. Then M1 is requirement for homeopathy preparation, and M2 is requirement of cosmetics, and M3 is requirement of medical devices. And N is the list of minimum equipment for an effective running of pharmacy, and O is the standard for disinfection fluids, and P is the life period of drug, and P1 is the package size of drug. And the Q is the list of dyes, color permitted in cosmetic and soaps. Then R is the standards for condoms of rubber latex or medical contraceptive, and S is the standard of cosmetics, and T is the requirement of factory, premises and hygienic condition for Ayurveda, Siddha, Unani system of medicine. And U is the particular to be shown in manufacturing records, and V is the standard of patent and proprietary medicine, and W is the drug which only marketed under generic name, drug which are only marketed under generic name, and at last Schedule X is the list of narcotic and psychotropic substance.